Okay, this is from the book, John McDougall, The Doctor Who Fought for You, by me, Pete Rogers. We're talking about newsletters and research papers that John McDougall spoke about and wrote about. One of the things he talks about is soy protein isolate. Now, soy protein isolate is not the same thing as soy. It's an isolated form of the protein. It's not like a whole food of soy. Don't get me wrong, I think soy is a bad food in general, but when you isolate components of it, then it's significantly worse. Okay, so Dr. McDougall was saying that soy protein isolate will likely increase the risk of kidney stones. Soy protein isolate also increases insulin-like growth factor type 1, so it might increase the risk of cancer. Soy protein is a common ingredient in processed foods. For example, eating soy protein bars will increase insulin-like growth factor 1 and will lead to more calcium in the urine. That's one of the major pitfalls of animal protein and soy protein. ILGF, insulin-like growth factor, increasing bone mass, but meat and soy protein isolate they produce a big acid load on the body that counteracts the ILGF effect, and it can also have other negative consequences of increasing the risk of cancer. In general, when ILGF is increased, it tends to accelerate the growth of cancer because it's like a growth factor. It's like an activation of mTOR type effect. Okay, isolated soy protein causes the body to excrete calcium, and this appears to increase the risk of osteoporosis. Okay, anytime you isolate a protein too, you're going to have more free glutamate, which I don't like as well. Foods that increase insulin-like growth factor are usually also high in acid and high in protein. The net effect of foods that increase insulin-like growth factor is that they usually increase the risk of bone loss, kidney stones, and cancer. Thomas Addis was the researcher who showed this. And he also showed reducing renal work, like by reducing protein, would protect the kidneys. Okay, Dr. McDougall then talks about protecting the kidneys. He says a low protein, because this lecture is about osteoporosis and kidney function. A low protein diet reduces the progression of kidney disease and death by an average of 33 to 50%. That's a lot. Okay. Let's say you had a 50% effect. Instead of dying in 10 years, you die in 20 years. Bisphosphonates suppress bone turnover. There are some hazards with Fosamax and Actonel. They can potentially lead to severe bone, joint, and muscle pain. They can lead to decreased fracture healing. In the long run, over 7 years, they can potentially lead to more fractures. This is sometimes called bone necrosis or osteonecrosis, from the McDougall newsletter in 2005. You can get all these newsletters at Dr. McDougall's website, drmcdougall.com. Any of his videos, you can watch them at his YouTube channel, Dr. McDougall Medical Center. Hip fractures also tend to be hip fractures tend to be the worst of the osteoporosis fractures. Osteoporotic spinal fractures can also be a big problem for patients. Hormonal replacement therapy is not good for preventing osteoporosis fractures. In order to prevent one hip fracture, you would need to treat 10,000 patients for 2.8 years. The best way to prevent osteoporosis is to eat a healthy diet and to exercise. If one of my patients had an abnormal bone mineral density, I would tell her to delay accepting drug treatment. I would tell her to eat a healthy diet and to exercise, and then she could repeat the bone mineral density test in about 2 or 3 years. Cow's milk does not prevent osteoporosis. The purpose of cow's milk is to help a calf to grow quickly. Cow's milk is high in insulin-like growth factor type 1. Hormonal replacement therapy has only had a small effect on fracture risk reduction in women. About 3,100 women must be treated to lead to one less fracture annually, and you can bet all those women had side effects. Okay, other problems with dairy. It increases the risk of type 1 diabetes. It slows down gut peristalsis, so you get constipation. It lacks vitamin C. It's high calorie, high fat food, and it's also so it's associated with obesity, diabetes, heart disease, heart attacks, and stroke. It's highly allergenic. It's associated with autoimmune diseases besides type 1 diabetes, also multiple sclerosis. Dairy can contain environmental contaminants associated with increased risk of Parkinson's disease and brain damage. Yeah, and dairy's, it's bad. It's increased risk of prostate cancer. Dairy is associated with increased risk of some forms of cancer. Dairy can contain a variety of microbes, including E. coli, mad cow, bovine leukemia virus. The purpose of cow's milk is to help a baby cow grow rapidly. Cow's milk is not made for humans. The only good food for infants is human breast milk. It's from the Dr. McDougall newsletter, January 2004. And he felt that formula bottle feeding causes infant brain damage. He thought it was a really bad idea. Human breast milk has 5% of calories from protein. That's all a baby needs. So only 5%. Actually, I've looked at different articles say 6%, but 5 to 6%. Okay, so that's all you need in the most rapid phase of growth. So the rest of your life, you can expect you would need significantly less. Kempner fed his patients an incredibly low percentage of calories from protein. It was something like about 3%, in between 2 to 4%. So it's really low. And I've read other studies where people were fed even lower amounts of protein. We really need far less protein than is widely suggested. Okay. And like I said, if that's the most you need in the rapidest growing phase of your life, you know for sure it's going to be less. And it's hard, to get your protein down to 5%. It takes a lot of effort. Fruits are pretty low in protein. Beans are really high in protein. Animal foods are sky high in protein. A baby should be breastfed. Some of these baby formulas are toxic. A woman should eat a healthy diet before pregnancy and during pregnancy. The mother's diet is important because it affects her milk. Beginning around 6 months, a baby can eat solid food. A baby should not eat a low-fat diet. Human breast milk is about 50% fat. After being in terms of calories, 50% of calories from fat. After being weaned from human breast milk, a baby can eat nuts and seeds if it's okay with the pediatrician. It seemed to me that Dr. Mcdougall believed that babies be breastfed for at least 6 months if possible. The higher a woman's dietary calcium intake, the higher her risk of fractures. For example, it's the Western countries with high intakes of calcium, like Denmark, United Kingdom, USA, that have the high rates of fractures. It's not the populations that don't have all this milk. Okay, he continues, excessive dietary fluoride causes increased bone mineral density, which is called fluorosis, but those are not healthy bones. Fluorosis-related bones are brittle, and they are at increased risk for fracture. Thus, fluorosis causes increased density of bones, but the fluorosis bones are at increased risk for fracture. And that makes you wonder, a lot of Americans are drinking municipal tap water with fluoride in it, and that has an effect on the spine. And is that going to paradoxically increase their bone density, but not in a useful way? I would bet that it does, because I think it's related to bridging osteophytes of the spine that look very much like DISH, diffuse idiopathic skeletal hyperostosis. So that's going to make the spine more dense, but it's not going to improve it. Okay, endemic fluorosis is a really big problem in India. Spinal fluorosis can mimic the appearance of ankylosing spondylitis, of DISH, diffuse idiopathic skeletal hyperostosis, and of ULF, ossification of the ligamentum flavum. Just bulky bone being added to the spine could cause problems. So here's a Dr. Mcdougall, I think it was a newsletter, and a YouTube video, How is Milk Going to Make You Blind?, where he disputes major medical treatments, osteoporosis and broken bone business. Okay. And then the newsletter, June 2007, How to Save Your Kidneys, had some additional information on these topics. Protein in urine of 30 milligrams a day or higher is the hallmark sign for the beginnings of chronic kidney disease. It's called proteinuria. Over 300 milligrams per day is serious kidney disease. In general, the more protein you're losing in the urine, the worse the kidney disease. Some medications claim to be renal protective, but they lead to increased risk of dying of heart disease, so that's not good. Overtreatment of hypertension can lead to increased risk of cognitive impairment. If your lower pressure is too low, you don't get enough blood to the brain. Hypertension, elevated cholesterol, and type 2 diabetes are due to the Western diet. Likewise, the health of the heart, kidneys, and arteries and rest of the body is dependent on a healthy diet because it affects blood flow to every organ in your body. What is missing in the current treatment of people with kidney diseases is diet therapy. Dr. Mcdougall letter in March 2011 on baby breast formula. Breast milk is the best food for babies. If a child must have formula, I recommend hypoallergenic cow's milk formula. Okay, so we'll leave it there for today. I hope that was helpful.